Type 1 and Type 2 diabetes, understanding the differences. Diabetes is a chronic disease that affects millions of people in India. There are two main types of diabetes, Type 1 and Type 2. It is important to understand the differences between the two as they have different causes, symptoms, and treatments. In India, Type 2 diabetes is more prevalent than Type 1, with an estimated 77 million cases in 2019. This is due to factors such as genetic predisposition, unhealthy diet, and a sedentary lifestyle. It is important for people in India to be aware of the risk factors for diabetes and to take steps to prevent or manage the disease, such as through regular exercise and a healthy diet. Type 1 diabetes. Type 1 diabetes is an autoimmune disease, which means that the body's immune system attacks and destroys the cells in the pancreas that produce insulin. Insulin is a hormone that regulates blood sugar levels. Without insulin, the body cannot use glucose for energy, and high levels of glucose build up in the blood. Symptoms of type 1 diabetes include frequent urination, extreme thirst, hunger, fatigue, and weight loss. Type 1 diabetes is usually diagnosed in children and young adults, but it can develop at any age. Treatment for type 1 diabetes involves insulin therapy, which replaces the missing insulin in the body. People with type 1 diabetes need to monitor their blood sugar levels regularly and make adjustments to their insulin doses based on their levels. Type 2 diabetes. Type 2 diabetes is the more common type of diabetes, accounting for about 90% of all cases. It occurs when the body does not use insulin properly, a condition known as insulin resistance. Over time, the pancreas may not be able to produce enough insulin to compensate for the resistance, and high levels of glucose build up in the blood. Symptoms of type 2 diabetes include frequent urination, thirst, hunger, fatigue, blurred vision, and slow healing of wounds or sores. Type 2 diabetes is usually diagnosed in adults over the age of 40, but it can develop in younger adults and children who are overweight or obese. Treatment for type 2 diabetes involves lifestyle changes such as weight loss, healthy eating, and regular exercise. Some people may also need to take oral medications or insulin therapy. If you're experiencing any symptoms of diabetes or have a family history of the disease, don't hesitate to see a healthcare provider for diagnosis and treatment. With proper management, people living with diabetes can absolutely lead fulfilling and healthy lives.